So, um, something that really, I guess, kind of jumped out to me that Dr. Drake had talked about was the payer system. And so, being a statewide coalition, we find it very important to, build relationships and have good partnerships with the payers in the state that our providers are relying on. So, we build good relationships with the MoHealthNet division, with the Department of Social Services, with the Department of Mental Health. Even, at our level with the state budget office, Brent, our CEO, has, numerous meetings with them to advocate for the behavioral health system in Missouri so that we can do the things that we know we need to do. We strongly advocate for improving service rates. We know that providers can't implement evidence-based practices. They can't implement innovative care to lead to better recovery outcomes if there isn't a payment system that supports that. So those are things that we're really working on improving in the state. With our certified community behavioral health organizations, expanding those so that more areas of the state, the entire state, hopefully will end up with having a CCBHC within their area so that it breaks down those silos. They can walk into that CCBHC and get the service they need, whether it's mental health or substance use treatment or both. So, and then they're also having, even within the CCBHC model, their physical health addressed. So, we're really looking at serving the whole person. And I think Missouri's done a great job of moving in that direction throughout the years. And we're going to continue to improve upon that. We know we need to continue to improve. We did talk about outcomes, and I agree with Wendy that an area where we struggle a lot in this state is outcomes of successful recovery. We can show cost savings in programs. And again, that's important. We have to be able to do that to satisfy our payers, to satisfy state legislators. But how are we improving lives for people?
Did we lose Natalie there?
It looks like we might have lost Natalie.
I think we might have. We'll see if we can get Natalie back to finish her comments. But at this point, I think we'll move on to Jama Dotson.
Oh, Natalie, did we get you back?
Are you back now? Okay, there she is. Go ahead, Natalie. Sorry.
So we want to be able to use data and figure out how to use data in a way that will measure recovery success. We've been working with, academics at the Missouri Institute of Mental Health to help us figure that out. So I think it's a direction we're moving in. We're just not there yet, but we're going to continue to work on it. Specific with implementing systems that show recovery. One thing that we're currently working on that I'm very excited about is implementing the ASAM criteria. That's the American Academy of Addiction Science. So we're really wanting to move all of our systems into these, these more gold standard type treatments that have shown positive outcomes. But again, we need to figure out how we can put those positive outcomes into a meaningful way to present them to others. So those are the things that I, was just kind of jumped into my mind as I was listening to Dr. Drake and the other panelists today.